Thank you for joining us for this webinar on Provider Relief Fund Reporting. My name is Susan D'Antoni. I'm the Executive Director of Montgomery County Medical Society. A few housekeeping items before we begin. We have muted participants at the beginning of this call for sound quality purposes. To mute or unmute yourself over the phone, press *6. On a PC, Alt plus A. On a Mac, Shift plus Command plus A. We welcome your questions. You can also submit them via the chat feature. Today's program will provide an overview of the process for reporting to the Provider Relief Fund, also sometimes referred to as HHS Stimulus Payments. Medical practices are required to submit reports on the first distributions of PRF funding by tomorrow, September the 30th, 2021, although there is a 60-day grace period. There will be additional reporting periods coming up as well. Today, we'll also discuss auditing and how to use the reporting portal. Our speaker today is Maureen McCarthy, CPA, Managing Director, Medical and Business Advisors, a division of Categorizing. Medical Business Advisors has been a longtime partner of Montgomery County Medical Society. We have looked to Maureen to speak about many issues related to medical practice management. And now that she is with Categorizing, we have welcomed that firm as a Physician Connect partner, bringing the strength of two organizations together which have long histories of assisting and advising our medical practices and being committed to our community. We appreciate the collaboration with Categorizing, and we look forward to providing you with valuable future educational programs. So thank you, Maureen, for being with us today. We look forward to your presentation. Thank you all for joining us.
Thank you, Susan, very much. So this seminar was put together over the last few weeks because what was described to the providers as a simple reporting process for the HHS stimulus money that you all received in your bank accounts and applied for and got additional money. And when we were asked by a couple of clients to help them with the forms after they had gone into the portal and looked at what they needed to do, we realized that it wasn't the simple process that was promised. So we reached out to the Medical Society and said, I think we probably can give some guidance to the practices as to what they're really looking for and some tips and tricks to fill out the forms. Obviously, we are doing this for many of our practices. And if you need help, we will be available for calls and questions. But my goal today is really to demystify the process a little bit so that you can at least try to fill out the forms yourself and gather the information to get that done. Like, as Susan said, the deadline for the money that was received in April, May, and June is due. The reporting is due tomorrow. There is a 60-day grace period. They'd like you to still get them in by tomorrow, they're saying, but I think as long as you can get them in by end of October, that will be a good deadline for you. So let's go to the next slide. So let's talk a little bit about the provider relief funds and how they came about and how they were unrolled to the providers. So around April-ish, early April, I started getting some calls from some of our clients who said, I got a check in my bank account last night, and it says HHS on it, and I don't know what this money is for. So in doing a little bit of research, we uncovered that the funds were based on Medicare revenue. So if you were a practice that had a large Medicare population, you probably got a much larger check than if you had a very small Medicare population. So I have clients who got, $800,000, and I have clients who got 600. So, so that money just appeared. And then as that started to kind of, hit the listservs, they started talking about the second tranche. And the second tranche was where practices could actually apply for this money. And they haven't said this, and I actually watched a webinar yesterday about the new provider relief funds that are being released today, I think, or you can apply for today. It's about 2% of your revenue is really what they were striving for. So if you got 1.5% on your first check that was automatically deposited, or maybe you didn't get anything, the second tranche was where you could actually apply for funding. And a lot of practices did that. A lot of practices, were able to get some much needed funding during the early days of COVID. And so, that was the second tranche. The third tranche really was more focused on practices who do no Medicare, like behavioral health. A lot of behavioral health practices don't participate with Medicare. Pediatrics obviously have very few or little Medicare patients. So that third tranche was really to get some money to the practices that really didn't qualify or weren't automatically sent money in the early stages. So now we have a fourth tranche that's coming. They're calling it phase 4. So here's the reporting periods, and this is important. So back in January, they had sent out emails to all the practices that had gotten HHS money, and they asked you to register. So hopefully sometime in January, February, you all went into the portal, registered, got a password, set up a password, had a username. And that was like the first stage of this. And it was supposed to be, the reporting was supposed to start around the same time, but it didn't come out until much later. So if the money that was received was received between the dates of April 10th to June 30th, those are the funds that need to be reported on by September 30th with a 60-day grace period. So pediatricians, behavioral health, they didn't get their money till later, so they probably don't have to report right now. They may have gotten their money between July 1st and December 31st, and so that their reporting will be due in the first quarter of 22. So January through March of 22. And then, as you can see from this slide, it goes on from there when you received money. Now, this is going to expand because now there's new money. So the money that is being made available right now, it's a limited amount. It's a huge amount, but it's limited. So they'll be sending that money out between, say July 1st and December 31st. It'll be September, October, November, December. And that won't need to be reported on until January 1st of 23. So that's the reporting timeline. So you need to see kind of where you fall. One little tip, if you received more than one check, you can add them together when you report if they were paid in the same reporting period. So I had a client the other day who got, say, $30,000 and then another $14,000 during period 1. And then they got $1,167 in period 2. And her response was, I'm just going to send it back because I don't want to have to do this reporting again. So just beware that you may have to file twice on if you received money in different periods. Okay, next slide. So let's talk about the reporting requirements. So if you received less than $10,000 of PRF money, HHS stimulus money, the only thing that you are required to do is go in and register. It'll say right on there how much money you've received. If it's less than $10,000, you're done. That's all you have to do is register. If you received $10,000 to $500,000, you need to do the report. But the good news is that it is abbreviated. you don't have to report real specific line by line expense data. So it is a little easier to report. If you received more than $500,000, it's a more detailed reporting. There are general and healthcare expenses that you have to report with subcategories and all of that. So that, makes it a little bit more time consuming and complex if you received more than 500. So the other thing I want to mention is that if your practice received more than $750,000 from the government in 2020, or actually during the COVID period, so April 2020 to right now, June 30th of 21, you are going to be required to do what they call a single payer audit. And that is a financial audit where you have to disclose the money that you received, how you spent it, when you spent it. It will need to be done by an accounting firm, and that will have to take place in 2022 because they're probably going to ask you how you spent the money all the way through 2021, 12/31/21. So just be aware that if you got more than $750,000, you may have that requirement. Okay, next slide. So what kind of information do you need to report? One of the things that I want you to know, if you haven't already looked at this, is you have to sign into the portal and you need a username and you need a password. So once you sign in, it's a series of spreadsheets that you need to fill out. So our recommendation is to have as much information that they're going to ask for at the ready so that you can work your way through the spreadsheets. I think there's 5 or 6 spreadsheets. Some are very simple and some are, a little bit more information. So what you'll need is your login and your password information, and that would be from your initial registration. It's also showing on your emails that you're getting from the PRF people saying, hey, reporting's coming up. So you need to have that. If someone else is going to do this for you, you can give them your login and password information. At first, they would send the doctor who registered a code on their cell phone or email, and then we would need to get that from them. It appears that has been taken off, but you may be asked to change your password if you go in there. So if you're having someone else do this for you, just be aware that might happen. You need to have a list of the total amount of HHS money that you received and when you received it. And if more than one payment, like I said, we need to report on all of them together if they fall in the same period. So we need date, we need amount, and we need that for all of the money that you received for the HHS stimulus money. You will need your profit and loss statements by quarter for January 1st of 19 through June 30th of 2021. Now, if you have QuickBooks, it's pretty easy to run a quarterly profit and loss statement, and that is really the way to approach this. It's for 10 quarters though. And on those P&Ls, you're going to have to pick up expenses, and you're going to have to account for those. So you really do need that, those quarters broken down. And that we find is the easiest way to do it. You could hopefully run a quarter by quarter all on one, page that shows you, different expenses and whatever, but you all know your systems better than I do. So the other thing you'll need is your total revenue for total patient revenue for 2019 and 2020. So just running a P&L for those periods of time and have that ready. It's also really helpful to have your PPP loan application and your loan forgiveness application. And the reason for that is that they're going to ask you what money you got from all different sources. So you're going to need to know the money you got for PPP, EIDL, any kind of grant money from the state. I mean, they're going to ask you to list out all of the funds that you received. And that, that will need to be reported. The PPP loan forgiveness application helps you to identify what expenses you used for your loan forgiveness for PPP versus what was left and what you're going to use to show them how you spent your HHS PRF money. So that helps a lot if you have that in front of you, because it shows, what expenses you used for forgiveness. Okay, next slide. This spreadsheet is probably the hardest spreadsheet in the whole reporting process. So this is a little hard to see, but basically what they're asking you to do is to account for your FTEs split into two categories, clinical and non-clinical, full-time and part-time, and they want you to do this for 10 quarters. This one spreadsheet is what has taken the longest period of time to compile the information and then to go through these forms and complete them. So basically, just a couple of things I want to point out. So you can see where the full-time is broken into clinical and non-clinical. For clinical, we include providers and MAs, lab techs, that is somebody who's actually involved in patient care, back office stuff. For non-clinical, it's everybody else. It's your front desk, it's your billing, it's your managers, it's all of that. So that's how you break down the first two sets of information. They want to know if you have any 1099 contractors who worked for the practice. Now, this doesn't include 1099s that you send out to your billing company or your accountant or your lawyer. It doesn't include that. It's contractors who you are treating as 1099 people within your practice. So that's how you fill that out. They want to know if you furloughed any employees, and they want to know during what quarter that occurred and if it was clinical or non-clinical. So if you furloughed your folks for, 4 hours a day, you only open half day during the period of, say, March 20th to April 15th. Very short periods of time, you didn't really furlough anybody completely. Unless you really furloughed somebody completely, I probably would, not necessarily fill that in. But I think if you kept people, mostly as paid employees, I think that, that's really what they're trying to get to, because they want to make sure you use the money for what it was intended for. So the next part is separated, which basically means that did you lose employees? Did employees leave you? And they want that broken down by quarter, and they want that broken down into clinical and non-clinical. The last part is employees that you hired by quarter, clinical, non-clinical. Now, what you really need to make sure you do is if you have your, say, ADP report or Paychex report or whatever you use, if you paid 15 people during a quarter, you want to make sure that when you do the math on how you filled in the column, that you come down to 15. So if you had 4 full-time clinical, 8 non-clinical, that's 12. You didn't have any part-timers, no contractors, you didn't furlough anybody. I'm looking at first quarter. If you had people separated, you would subtract that from your employees. And then if you hired anybody, you would add that. But basically at the end, you want to come up to the number of employees you paid during that quarter. So that, adding a little sum column at the bottom, that helps a little bit to make sure that you have this information. We actually filled this out with a client the other day, who had less than 20 employees. It took us a good half an hour to go through all of her data with her and fill this out. So, it's a little tricky, but it's information that you should have available from your payroll company. Okay, next slide. So this is an interesting bit of information that they're making you report on. So first of all, let's go down to facility metrics at the bottom. Unless you're a nursing home, you don't have to report on this, or unless you have beds, unless you're a hospital. So the bottom part, most of you will not have to report on. And when they say beds, they mean hospital beds. They don't necessarily mean a ambulatory surgical center bed where you're doing outpatient stuff. So the top part of this does need to be filled out though. And so they're asking for inpatient admissions, and they're asking for emergency department visits. So most of my practices have been able to go on CRISP and pull this information. I had a couple practices who only operate, deliver babies out of one hospital. They called the hospital and asked them for this information. But this is information that you're not necessarily going to have anywhere else. And so using CRISP or calling your hospital and filling it in that way, you need to fill this out. This is not something that you want to just leave blank. The other thing is, if you have anything that is 0, you need to put a 0 in, or it won't let you move on to the next spreadsheet. So outpatient visits. So the way that we have been doing this is you either run number of encounters, and your encounter could include a visit, a vaccine, an EKG, but we're trying to figure out how many encounters you did. The other way to do this, if your system doesn't run things by encounter, you can just run a CPT frequency report and add up all your visits by quarter. So all your 99, 20, 1 through 5, new patients, established patients, well visits, and consults. So that's another way to do it. But you basically are just saying how many outpatient visits did you do during each of these quarters for 10 quarters. So that is a little tricky to get depending on what system you have, but those are some tricks that we have found as we've been working with clients on these. Okay, next slide. So just a few tips on and telehealth is included. I see Dr. Saba's chat. Telehealth does count as an outpatient visit. So yes, include those. And that should print out on your report because we use the same codes for telehealth visits. So other assistance received. This form is asking you to list all COVID-19 related monies by category and by quarter. So you're listing out all the money that you received from all the different government sources. So the infection control spreadsheet, it's only for skilled nursing facilities. So you can skip over that if you're an outpatient practice. If you see patients in a nursing home, you still don't have to fill that out. So I think most of you will not have to worry about that. So then the other PRF spreadsheet, they want to know how you spent your stimulus money. But they want to know how you spent your stimulus money, and they want you to take out the PPP money that you've already reported to the federal government as to how you spent that. So if PPP, you used a 24-week period and you met your forgiveness with payroll, that makes it easy. But a lot of practices did payroll taxes, some rent, some utilities. So you need to make sure that you're picking all that up. And that's why that loan forgiveness application in front of you is very helpful. So they categorize the expenses as such. Under general and administrative, they include mortgage, rent, insurance, payroll, benefits, utilities, operations, lease payments, other G&A expenses. So what I'm going to say to you is, let's focus on the healthcare related expenses, and let's include medical supplies, medical equipment, IT, including your EMR, your practice management system, your telehealth stuff that you had to buy, all the new systems that you had to purchase to be able to do your virtual visits very quickly. If there are particular facilities that are just clinical areas, and then other healthcare expenses. What we did with this was we picked up medical supplies, vaccines, virtual, any kind of money that we had to spend to do telehealth visits very quickly, We also included in that anything you spent for COVID, masks, sanitation, plexiglass to, protect your staff, all of that kind of stuff. So that goes in healthcare expenses. And then I would count everything else as a general administrative. So let's go to the next slide and look at this spreadsheet. So this is a spreadsheet that we put together. So I think this could be really helpful for you. And we literally did this for all 10 quarters. So let's assume that we look at your profit and loss statement for quarter 2, 2020, and your total expenses for that period were $609,000. We know that we took $177,000 of that and we used that for PPP loan forgiveness. And it was split out as follows: owner's wages, staff wages, payroll taxes, some rent, and then some other expenses were used that were utilities and that kind of stuff. So we know of that $609,000, we've already used $177,000 of that to get PPP loan forgiveness. So we can't include that. So what we have left from that, the 609 minus the 177, is $432,000 of expenses. We pull out the healthcare related expenses, again, medical supplies, medical equipment, vaccines, telehealth, type equipment and whatever. And so now we know that our total expenses that we're going to claim for PRF is $314,000. And we're going to put $117,000 on the line item that is healthcare related expenses. So if you were looking at the form, this might make a little bit more sense, but they're going to ask you by quarter for two numbers: G&A expenses and healthcare related expenses. The sum of those two is going to be your total expenses less expenses claimed elsewhere, which is usually PPP loan forgiveness. Okay, next slide. So if you get to the end of your report and you have not been able to justify how you spent the HHS stimulus money, there are alternative calculations that you can use, and they're based on lost revenue. So that's a whole different calculation. To be honest, I don't think there's very many of you that haven't spent the money on G&A expenses and healthcare related expenses. So I don't think you're going to have to go to this level. But if you get to the end and you find that you cannot justify that you spent all of the HHS stimulus money, you can go to the alternative method. And they do have spreadsheets in there for you to calculate that. There's also a reconsideration process if you are denied additional funding, or you think you didn't get enough funding. If you do a calculation after this call and take 2% of your gross revenue for 2019, and you feel like you didn't get that much stimulus money, you can ask them to reconsider, or you can just apply for more money under this new phase 4. But there is a very, they say it's a very simplified process for the reconsideration. So you can judge that as you look at it. Okay, next slide. So before I do this, I'm going to go to the chat, just see if there's any questions on the actual reporting. So does the rent mean full rent or rent pertaining to COVID issues? So interestingly, when the PRF money came out, they said it was to be used for COVID expenses, but anything in a healthcare practice is considered COVID expenses, because you are spending money to keep your office open or to keep your office ready to reopen as soon as you possibly can. So I think that if you think about it in that way, that will give you, a little different perspective on it. So let me, so we sent out the link for the reporting portal. And this is probably an inefficient way for me to do this, so I apologize. If you formed a new group practice 1120, do you need to get a P&L and payroll reports for pre-merger? So there's actually some guidance on that under this new money that is available. So my recommendation would be that you read kind of what they're looking for. And if you have questions, you can certainly reach out to us, but there is some guidance for new practices. If you're pediatrics and don't admit, I mean, they're really looking for hospital admissions on your patients. So, you know, if CRISP is reporting to you that one of your patients ended up in the hospital or ended up in the ER, that is the information that they want reported. So the answer would be you still should report that even though you didn't see the patient in the hospital. So where do we need to add the P&L numbers? That goes on the other PRF expenses form. So that's where, you know, I have to tell you that when we started filling these out, we read the wording, we read the instructions, and we went in one direction. And then we called to ask a couple questions. We called the PRF line, which actually they were very helpful and we got right through. We had to go back and redo some of the forms. So what I'm telling you today of how you should fill out the form is directly from the PRF office. So that may be a little bit different than how you originally read the form. Telehealth counts as outpatient visits. Yes. You can report loss of patient revenue if you want to use the alternative method. I would suggest that you try the other one first because I think it's a little bit more, I think it's easier to report on. So your practice received much less. Do we need to fill patient encounters out if we have no hospital patients, nursing home? I think I just answered that. What if you had someone resign? How are they considered on the report? So if they resign, they're separated, not furloughed. Okay, some of these questions are very, very specific, so I'm going to leave them for the end. Okay, so let's just, I just wanted to go over the new funding. Phase 4 opens today. There is $25.5 billion available. Interestingly, 39 of that, I think it is left over from phase 3. So that's included in that money. So there's $8.5 billion of this is for rural providers. The eligibility formula is going to use Medicare and Medicaid claims data. So when you apply for this, they're going to look at your claims data and they're going to look at your patient population and where they live and you know, how far they live from healthcare services and whatever. And so they are, you know, they're going to use that data to get that money directly to the providers in those areas. Phase 4, again, is modeled after phase 3. We looked at the forms. They're almost exactly the same as the ones you filled out before. They just have some different dates on them. So there's $17 billion available to apply for. 75% of this money is earmarked for practices that can show lost revenue and high expenses, so losses in general in the practice. In other words, the practice has not recovered after COVID. So that's how they're going to do it. There is an additional bonus payment for medium and small practices. They didn't have the definition of what is a medium and small practice, so they told us that that actually would be coming soon. And then the remaining 25% is going to be dedicated to providers who serve Medicare and Medicaid patients. So if you can't show lost revenue or losses in general, and you don't see a lot of Medicare and Medicaid patients, I'm not sure you're going to get much of this money. But based on the forms, they're not difficult to fill out. I would just go ahead and submit it if you can, because you know the worst that can happen is you get zero. And I don't think it will be a time-consuming form to fill out. Okay, next slide. So that's the end of the presentation. I'll be glad to take questions to the medical society, through the medical society, and we'll answer them until the end of our time. We have 23 minutes left.
So this is Dr. Rosie Singh. Can you hear me?
I can.
Yes. Okay. So thank you so much for beautiful presentation. And thank you, Susan, for putting this together for all of us. My question is, when I was looking on the forms, and so the reporting period, I know you came up with the numbers, like if you receive more than 500 or 750, all of the medical practices got a much smaller portion in April, and some of us got it in May because.
Too much pain. No.
I'm sorry, I can't hear.
Can you hear me okay? I'm sorry.
There's some background noise.
I'm in my office. Let me shut the door. So my question is, we received much less than $500,000 for the reporting period, which is between April and June, I believe. And all the practices got the first check in April, and some of us got another check in May because, based on your, like you said, rightly, like Medicare revenue kind of thing. All right. So when I was looking at it and also listened to the webinars, it seemed to me that you didn't really have to go through the whole expenses, but if you can show revenue loss comparing to 2019 for all the quarters, because they said, come March of 2020, there were significant losses. So as long as it didn't date back prior to January of 2020, all 4 quarters of 2020 and the first 2 quarters of 2021, comparing to the similar quarters in 2019, if you were to be able to show what your revenue losses were, patient revenue, and they go on to ask you what portion of it is from Medicare, what is from Medicaid, etc., right? Which is easy to pull up, right? Because you can actually see from your EMRs what your patient revenues are, not necessarily profit loss, okay? Because to me, it's really tedious to have to show the expenses. Like you said, PPP loan, we did receive and it was forgiven, but we used it not just for payroll. I wish we had just used it for payroll, but we used it for health insurance. We used it for, utilities or whatever, right? So with the result, it ran out, it didn't last 24 weeks, right? So now, if we were to subtract that, now it's an onus on us to show that this is our payroll and we only used it for 8 weeks or 3 pay periods or whatever. The rest is still our expense. So I think it's very cumbersome to have to do that. If we are able to just show the revenue loss, and then, of course, from the payroll journal showing that we didn't really fire anybody, for that matter, every practice is different, was what I was hoping. But we did receive more than $500,000 in aggregate. The last check was, I think, in January of 21, if I'm not mistaken. I can tell you the exact date. And it was in December of 2020. And I can speak on behalf of many primary care practices that have joined, that most of them got a much bigger check on December 16th, which will probably amount to more than 500,000 or, 750 for most of us. So now I just wanted to ask you, with your expertise, whether or not we can just get by with patient revenue loss, or we have to go through and segregate all the expenses and show profit loss. And like you said, everything is patient related in a way, but then what are your general administrative expenses? Everything we do is patient related, right? We're paying rent so we can see patients. Payroll, you need your staff, right? Health insurance, you have to have so you can keep your staff. So whatever, all of it, vaccines, supplies, medical supplies, sanitation supply, all of it to me is, so what would you put as general administrative if we were to have to report the expenses. And I'll shut up and listen. Thank you so much.
So look at the form, and it actually, if you've got less than $500,000, it's asking you to report 2 line items for 10 quarters. If you got more than 500,000, the grid below needs to be filled out, and that actually highlights a list of general and administrative expenses versus the healthcare related expenses. So that's how we came up with that. So we basically took medical supplies and things that were actually used to treat the patient. I hear what you're saying about the staff. It's all related. I agree, but we just use the list. The question, the lost revenue question, my only thought on this, because if it's easier to do lost revenue, I'm all for that. But my question is, if you don't fill out the forms, you can't move on to the next form. So you don't get to the lost revenue calculation until you're much further along in the spreadsheets. But I think it's an excellent question, and I don't have the exact answer. So, but if it's easier to do lost revenue, I think that's just fine. I just am curious if you can do that in lieu of the other spreadsheet that shows expenses.
So Maureen, thank you so much. The question is, no, we were able to move on. I put it in all the way, and I thought, I'll wait for this session because it's so informative, and see whether or not, if we are not 100% sure, we should wait. But the language, even with the grace period, seemed to us like it would be better to report by tomorrow. And I wanted to kind of, get your input on that. The second thing was, we were able to move on, right? So like on the top, there are like many, many things. And if you actually just go and skip the expenses, the lost revenue comes. And if you do the expenses, the lost revenue does not come. So there are like 9 of the little tabs on the top. My only question is, since we in aggregate received more than 500,000, are we obligated to do the expenses? And could you please be kind and show me that slide again? The one that said, up to 500, whatever. Is that defined by a time period, or is that total in aggregate?
It's money received in aggregate.
Even though we are reporting for this time period.
So it's money, it's 500,000 received in this period. So total, if you got 400,000 in this period, then you would report on the top 2 lines. And if you got 100,000 later and it falls into another period, I would just report on the 100,000. But it is an aggregate, so it could bounce back to you.
Okay, thank you.
But I think that whatever is easiest but accurate is the way to go. So if you think lost revenue is easier to calculate, and you can line up your 2019 quarters next to your 2020 quarters and report it that way, I'm all for easy. But I actually, we haven't used that method, so I don't quite know how easy it is. But if it's as simple as lining up your revenue by quarter and comparing it and showing lost revenue, then I think that would be an easier way to go. And you win the prize today because you came up with the best tip ever.
Question on the expenses. So if we are going that route of general expenses and healthcare expenses, and let's suppose we got $300,000, and in just Q3, our lost revenue, let's suppose, is 400, right? So I think that screen only allows to put up to 300, right? It won't allow me to put 350 or anything more than what we got. So when we go to the next screen, it says unreimbursed expenses. So are we mandated to put, let's say that Q3, $100,000, okay, this is not reimbursed. Maybe Q4 will be another 400. Are we supposed to keep on putting, oh, all these are unreimbursed? Should we even do that? Or I can put zeros and move on So are we mandated to put all that extra information for unreimbursed expenses when we already met my 300, in just one quarter.
Well, here's the problem. You can't leave a cell blank. So the only way to move on is to put zeros in there.
Yeah.
So that to me is not correct information because your expenses were not zero.
Okay.
So I think that you do have to fill them all out.
So then coming back to Dr. Singh's question before, so the only way she can move on to that, revenue loss thing is she has to put zeros on all of
Yes, that's
this.
correct.
So coming back to her point, yeah, she cannot put zeros. Then if you're saying, hey, that's not accurate, it's not like zero you actually spent on this.
Right, right. And it doesn't really give you a way to footnote something saying we're using the alternative method, so we're not filling this out. Now, this is a really good question, and we are more than happy to call the folks back at the HHS STIM office and ask them this question and get back to everybody, because I think this is a great conversation and a great question. Can we do this?
I did call them a couple of times. They're very nice, very friendly, but I don't think they're as knowledgeable though. They're like, we're not sure. So we called like 3-4 times. My accountant called them 3-4 times. Not direct answers.
Maureen, can I ask you a question?
Sure.
Maureen?
Yes.
All right, this is Dr. Massoud. The question I have is on patient metrics. Under patient metrics, when they write down outpatient visits, does that mean office visits? And does every office encounter, does it have to be tallied up, or is that hospital outpatient? I'm not clear.
So it's outpatient, it's office, but it includes telehealth. So it wouldn't include hospital visits, but it would include virtual.
So every physician, every provider, every physician has to tally up every single office visit in a period of time and put it in there?
Yep. And you're reporting on behalf of the practice. So you take all the visits and add them together. But the hope would be that you have a CPT frequency report that you can run for each quarter saying how many new, established, well, and consults did the practice do in this quarter, add it up, throw it in there.
Yeah, we can do that.
Maureen, this is Christine. I had a question. If we do the CPT though, sometimes when I see a well visit, there's then a 99213 that I code at the same time because of migraine headaches, they decide talk. So that's really only one encounter. It's not two.
So here's the problem. If your system won't run encounters, we have to figure out a way to report this. So we may be overestimating a little bit because a lot of primary care doctors bill a well visit and an E&M code if there's more than, if there's a different problem outside of the physical. So maybe what I would do is I would say, okay, I did this many physicals and 25% of those on average, I do an E&M, and I would do a calculation. It doesn't have to be exact, but we're just trying to figure out the easiest way to fill these silly forms out and be done with it. I have to, and I'm not saying I don't want it to be accurate because I do. But some of the stuff that they're asking for is pretty ridiculous.
Yeah. Thank you very, very much for this. This has been so helpful.
I think the bottom line is make your best effort and to provide accurate information to account for what actually happened in your practice during that time frame. Certainly the devil is in the details though. And so, we thank Maureen for providing this overview and also for getting into the weeds some. And we know that Maureen and Deborah, who has joined Maureen in Medical Business Advisors with Katz-Abosch, would be very happy to respond to your questions. We will also, Maureen, if you can find out that information, we would be happy to send that back out to the practices in our e-news, as well as those of you that were on today, and also to provide you with the links and the phone numbers that have been mentioned today as well. So on that note, we thank all of you for joining. Thank you again, Maureen, for an excellent presentation as always. We look forward and we are very hopeful to see you in person in the future. And thank you and have a good afternoon.
Bye, everyone. Thank you so much.